Hello and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and with me, as always, is Dr. Melvin Sanicas. Good morning, Melvin, and good morning to Switzerland.
Good morning, Professor Schmitt. Good morning, good afternoon, good evening to those who are watching us or listening to us today.
In this broadcast today, we bring to you studies on coffee. If you're a coffee lover, stay here. COVID-19 vaccine saved millions of lives in Europe. Then we speak about an artificial sweetener that may induce blood clots. Then we speak about a drug approved for brain cancer. I will bring you news on PCV24, on a PET CT and how it can help to find out diagnosis. And finally, I cover the efficacy of a new dengue vaccine. With that in mind, their first item is from Melvin, and it is about coffee. What is the news, Melvin?
Yes, so coffee and tea intake were associated with long-term cognitive changes in older adults. This is from two prospective studies presented at the AAIC, or the Alzheimer's Association International Conference. The first one is a study of 6,000 health and retirement study participants in the US drinking 2 or more cups of coffee a day, and it was associated with a 28% lower risk of dementia over 7 years compared with drinking less than 1 cup. And the p-value is less than 0.05. This was reported by the researchers at the Harvard T.H. Chan School of Public Health in Boston and Zhejiang University School of Medicine in China. In this poster presentation that they showed at the AAIC, they showed that moderate tea drinking, up to 2 cups a day, was also associated with a lower dementia risk compared with no tea consumption. And the p-value is also less than 0.05. So I think what we are trying to say in this first study is that coffee and tea drinking, 2 to 3 cups a day, is associated with a lower dementia risk compared with no or less than 2 cups a day. So I think that's good news for coffee and tea drinkers.
Yeah. Actually, I am a coffee lover, and people over decades try to find something that is negative with coffee, and whatever they looked for, there was nothing. And now it's good to hear it prevents dementia. And here is what I do. I have like 5 cups of coffee a day, maybe more. And I have 3 cups of tea in the morning. I won't come down with dementia. I'm pretty confident now. Yeah. Is there, did you also look at the combined use? Is there a synergy between?
This is separate. But in the other study, the next slide, please. This is actually looking at participants, over 8,000 participants in the UK Biobank, and looking at daily coffee and tea intake that predicted the slope of fluid intelligence decline. And fluid intelligence is really defined as reasoning ability and the ability to generate, transform, and manipulate different types of information in real time, right? And I think this is quite good because it shows that in the UK Biobank participants who never drank tea, they had a greater decline in fluid intelligence compared with those who had moderate 1 to 3 daily cups or high 4 or more cups per day of tea consumption. So,
yeah. Very good news for me.
Yes.
Thanks for bringing this up. This is wonderful. Yeah. Fluid intelligence. Wow. This is something I didn't know I had. And now to COVID vaccines. And what is the news here?
Yeah, so this is something that was published last week. It's basically just estimates published in the Lancet Respiratory Medicine. It shows that at least 1.6 million European lives have been directly saved by COVID-19 vaccination. And 60% of those lives saved were during the Omicron era, right? When Omicron was the dominant strain of the virus. And and actually the authors were saying that those numbers may actually be an undercount even. So as of March 2023, 2.2 million COVID-19 related deaths have been reported across Europe. And this data came from the WHO European Respiratory Surveillance Network, which analyzed vaccination efforts from December 2020 to March 2023. In the 34 countries, total vaccine coverage in adults aged 25 years and older was 87% for the primary vaccine series, 82% for the second dose, 71% for the booster, which I think it's not really surprising, right? If you have a 3-dose vaccination schedule, you will see that the first dose will have more vaccine doses given if you compare to the third dose, right? So it's similar. But here, it's an important study showing that in these almost 3 years of surveillance, vaccination in Europe saved at least 1.6 million lives.
Another piece of good news that you bring us today, and I like it, and this is based on surveillance data, right? This is not some health record finding or insurance company something. This is really surveillance data. And I think I remember the network from pneumococcal studies from the past. So very nice work, and thanks for bringing this up. What I also like, Melvin, is in Europe, what we learned from the US is we need numbers, not percent of life saved or something. But I mean, 1.6 million, this is, many big cities, right? This is Frankfurt plus Wiesbaden plus Cologne and I don't know what, right? So this is a lot of life saved. This is something, right? This is not negligible. Yeah.
Yeah, 1.6 is actually 3 times the number of everyone in Zurich canton.
Yeah. Yeah. Very good. And your next piece is erythritol. This is a sugar sweetener. So this is a sweetener. What is the story here?
Yeah. So although artificial and non-nutritive sweeteners are widely used and generally recognized as safe by the US and European Union regulatory agencies, there have been no clinical trials to really assess either long-term cardiovascular disease risks or short-term cardiovascular disease relevant phenotypes, right? And recent studies report that fasting plasma levels of erythritol, a commonly used sweetener, are clinically associated with heightened incident cardiovascular disease risks and enhanced thrombosis potential in vitro and animal models. And effects of dietary erythritol on thrombosis phenotypes in humans have not been examined. So to be clear, this is in animal models, but then these are prospective interventional study designs showing that there is a stimulus-dependent platelet responsiveness in healthy volunteers. And the plasma levels were quantified with liquid chromatography mass spectrometry, and the platelet function at baseline and following erythritol or glucose ingestion was assessed using aggregometry and analysis of granule markers released, right? And basically, it's showing that dietary erythritol, 30 grams, but not glucose, leads to a over 1,000-fold increase in erythritol plasma concentration and exhibited acute enhancement of stimulus-dependent aggregation response in all subjects. So in short, it's really telling us that the erythritol is, at least in animals, right? It's increasing the risk of aggregation of platelets and cardiovascular events.
Very interesting. I guess looking at evidence, this is biological plausibility, right? You find something in animal experiments, and this gives you a pathway, and it may explain observations. So the clinical meaning of this observation in humans needs to be defined, but at the same time, there is biological plausibility that this compound may be associated with thrombocyte aggregation and thrombosis in the end.
That's right. That's right.
Interesting. Yeah. Very good. Now you're covering one more on brain cancer. Nice thing. What is this one?
Well, this one really made me excited because, as you know, I have moved to oncology in the past few months. And so I've been learning a lot about cancer science and drugs. And this is a new drug for treatment of a type of brain cancer called IDH mutant low-grade glioma. It was approved by the US FDA just a few weeks ago. And this new drug came from a 2008 genetic discovery made at the Johns Hopkins Kimmel Cancer Center. The drug called vorasidenib is a targeted cancer therapy that works by inhibiting the activity of a mutated gene called IDH, and it slows the growth of the cancer, basically. And this is important because approximately 80% of low-grade gliomas contain an IDH mutation, according to the National Cancer Institute. And they include IDH mutant astrocytoma and oligodendroglioma, and they occur mostly in younger adults. Um, and low-grade gliomas tend to be slower growing and are associated with longer survival than aggressive high-grade gliomas. Treatments include surgery to remove as much of the tumor as possible, but then this new drug is a very good adjuvant because it really slows the growth of the cancer. And it could delay the need for radiation therapy and even chemotherapy.
Yeah, very interesting. So there are more breakthroughs coming up. In my medical time, so many things have changed, and so many things where we were without any intervention. Now, all of a sudden, all these new interventions appear. This is just a wonderful era in medicine where many new inventions are made, and this sounds really exciting. Another exciting piece, man. Well, I am covering a new pneumococcal conjugate vaccine that is data from a phase 2 study. And the idea behind this is that the conjugation process of the polysaccharide to the carrier protein doesn't result in optimal targeting of the immune cells. And if you improve the conjugate, then you may come up with a better immune response. Now, what the company did here, they compared a 20-valent vaccine with 24 pneumococcal serotypes with PCV20. And this is the PCV20 serotypes here on the left side. And this is the comparison. If it is above 1, then the titer is higher. If it is below 1, the titer is lower. And if you see here at a 1 microgram dose, versus the 2 microgram dose of PCV20, except for 6B, where it is 4 microgram. So the dosing, if you use 1 microgram, the titers 1, 2, 3, 4, 5, 6 are lower very frequently. And this is the additional serotypes, which I don't cover here. Now, then they use, instead of 1.1, they use 2.2 microgram, and only 1, 2, 3, 4 serotypes were inferior to PCV 20, although I have to say the comparison is a little bit apples and pears because you compare 24 valent with a 20 valent, right? So you have four serotypes here. And then finally, what they did is they used 2 micrograms for good responding antigens, and they used 4 micrograms for those that were inferior. And there you see the 4 micrograms is really nice. They're always above 1. But some of the responding serotypes, they are now below 1. And this is 1, 2, 3, 4 again. So it is good news and bad news. I like the idea of enhancing conjugation and also enhancing the immune responses and maybe finding new ways to construct the polysaccharide. And I think this is really a way forward. And the question then is, why not simply use 4 micrograms for all serotypes, right? Then it may work. I have no idea, but I think this is pretty good research, and I'm happy to see this data. Any comments?
Well, I think this is an interesting study because we have been really looking at ways of improving immunogenicity of the PCV vaccine, right? Because we all know that there are one or two strains in the vaccine, multivalent vaccines, which seem to be not really as good as the others. So I think this is an interesting study.
Yeah. All right. Then I have PET scan for finding a diagnosis in patients with fever of unknown origin, FUO. And if you are a clinician, I don't want to say this is your daily work, but very often you have a patient with fever and there's nothing you can find. You do a blood culture, you do all types of laboratory work, and there's nothing you find. You very carefully take the history. Is the exposure at a farm to exposure when hiking or to plants or I don't know what, mass events, right? And you find nothing. And this is a systematic review of 36 studies with more than 3,000 subjects. And they found that the contribution of PET scan, PET CT, was 75%. The sensitivity was 85%. So you have a very high likelihood that you may find something if there is something, but the specificity is 60%, which is still very good. And the contribution to PET scan for a single patient is 3/4. And to be more specific, 15% in FUO were found to be malignant tumors, 30% were infection, 27% were inflammation, let's say some rheumatoid diseases, autoimmune diseases, whatever. And then in about a quarter of subjects, the fever resolved and you didn't have a diagnosis. And then there were 5% miscellaneous. I think the study is nice, number one. If you can rule out malignancy, right, then this is good. You don't have a tumor. And if you then have an infection or inflammatory disease, you know what it is all about, and you can have specific treatment. And even if you find nothing, including no malignancy, I think it is very good. Very likely the fever will resolve and you don't find what you had, right? It is a very clinical problem solution method, and I think it seems to be very, very helpful. Any comments?
Well, I think PET CT is being used now more and more for finding things in the body, and so potentially in the future this might actually change practice, right?
It will get even better in the future, right?
Yeah.
Then there is another dengue vaccine. We have now two products licensed, the Sanofi vaccine and the Takeda vaccine. And this one is about, I think it's a small startup working together with the NIH in the United States. And they did a study with their vaccine in Brazil. And here, study participants received one dose only, not two. And there were 16,000 participants followed up for 4 years in a double-blind randomized way. And vaccine efficacy was 67%, but there were no dengue 3 or 4 cases. So we only know about dengue 1 and 2. Again, this is not a perfect vaccine. But overall, I think it is very promising. We need to find out more about dengue 3 and 4. And I guess I have to come up with a comparison, right? Comparing the three products next to each other to see what the benefits and risks of the different products are. But now we have dengue vaccine number 3 out there. Any comments, vaccine? Martin?
Well, this is another vaccine for dengue, right? And as we know, Latin America, Brazil especially, had and still is having a bad situation with dengue. So with this available, I think it can really help.
Yeah, and you can select, right? There are different. You have options now.
Yes, there are options. Yes.
With that, what we talked about today is that there is a protective effect of coffee and tea against dementia. Very important. COVID vaccines saved, in a surveillance study, more than 1.6 million lives in Europe alone. And Melvin explained to you why erythritol may be associated with blood clots. We heard that the FDA now targets brain cancer with a new drug that is working against some subtypes of brain cancer. I spoke about a PCV24 with a new conjugation technology. I showed you the benefits of PET-CT in patients with fever of unknown origin. And finally, I presented you the efficacy of a new dengue vaccine in a phase 3 study. Melvin, any idea on what this may mean that you brought with us?
Yes, so this is just showing us that writing often makes things clearer for everyone, right? I mean, I like to write things. It forces you to organize your thoughts, to articulate your ideas, and really engage in a process of reflection and refinement of your ideas. And I think it's something that I suggest to people um, who wants to have clarity on their decisions in life, even in their projects and in what they want to work on. Writing is really something that helps you have a clearer and deeper understanding of the subject of any topic that you want to deal with.
What I worry about, though, is that next generation, they will ask artificial intelligence to write up something, and they will no longer have the joy of getting clarity about their thoughts. I may be a pessimist here, but I'm not sure. Any thoughts on that?
I think you have a fair comment, and for sure for those who are very young now, I would say probably those who are like 10 years of age and younger. I think that's how they think now. They would ask chat gpt, gemini, or whatever ai machine learning programs that you have out there. They would prefer to ask them instead of really writing or thinking.
Yeah. With that, we say goodbye, and we will be back next week.
Thank you, everyone. Stay safe.